I am Tourangeau-Young, and I am a second-year resident at Wellington Regional Medical Center. I am presenting a case of subacute combined degeneration of the spinal cord due to volatile gas inhalation. Nitrous oxide is legal and easily accessible due to its multiple uses. In the medical field, we often use it as an anesthetic due to its rapid onset and short duration of action. Commercially, it is used as an aerosol spray propellant, commonly used in whipped cream canisters and even cooking sprays. However, due to its euphoric effects and easy access, it has become a popular recreational drug. So while the internet is relatively a new tool that patients can use to find medical information, the issue of self-diagnosis has been debated for centuries, with people frequenting libraries, medical texts, and newspaper articles to self-diagnose. Below, we discuss the consequences of heavy prolonged abuse of nitrous oxide gas. A 26-year-old female presented to the ED with numbness and tingling in her bilateral lower extremities. It had started in her toes a couple days prior to arrival, but progressively worsened with her tripping and falling over her own feet. The patient reports that she had been having anxiety and depression for multiple months, but over the last few months she had been treated with Zoloft, which she had stopped a week prior due to tiredness. She denied any other medical or family history. To help cope with her anxiety and depression, she also reported over the last 2 months starting to do nitrous oxide, which is also often referred to as whippets. During this ED visit, the patient had normal limit vital signs. Of significance on physical exam, her little finger and ring finger were numb, as well as from the waist down. Her patellar and Achilles reflexes were 3+, all others were 2+, and her Romberg sign was positive. Lab work significant for a hemoglobin of 11.4, vitamin B12 of 1,182, and homocysteine of 52.2. with the rest being unremarkable. MRI showed patchy areas of abnormal T2 signal throughout the thoracic and cervical cord, as can be seen on the right. In further questioning, the patient reported during her own research when she first started using whippets. She had found an article doing her own research which addressed the risk of vitamin B12 deficiency with prolonged use. So she actually started supplementing B12 as a consequence. Due to this and doing our own research, we were able to find that nitrous oxide actually inactivates B12. So even though her B12 seemed actually elevated, she was not able to use any of her B12 as long as she continued to use nitrous oxide. So due to this research and with her imaging and lab results, the patient was diagnosed with subacute combined degeneration secondary to this nitrous oxide use. She was treated with daily intramuscular vitamin B12 and transferred to inpatient rehab for aggressive physical therapy. She was also educated on the importance of abstinence from nitrous oxide for full recovery of her lower extremities or the adverse repercussions of long-term disability if she continued the use. So building rapport was very vital to this physician-patient relationship of being able to provide her with the proper workup, management, and treatment. Our patient's presentation seems spot on with a vitamin B12 deficiency. However, lab work at first did not match with that picture. It was not until we built the report, got that further history, and did our own research that we were able to make the diagnosis. Our patients did not fully grasp the mechanism of action when she did that research of the deficiency. She actually had a functional deficiency due to the nitrous oxide inactivating the B12. So as long as she continued to abuse nitrous oxide, she continued to inactivate any vitamin B12 she consumed in her diet or through supplementation. So this patient fits the demographic of those who are most likely to look online before coming to an appointment. She's young, female, and educated. And while she did read about nitrous oxide abuse and how it can lead to a deficiency, she did not fully grasp the mechanism. So this is not a case of medical information, but rather information that was written for lay people that ultimately left out details that proved to be important. She ultimately made a full recovery and was discharged home after 3 weeks of intensive rehab. Abstinence of nitrous oxide is key for a full recovery.